Next topic here, Sports Medicine Weekly. Dr. Cole, it's amazing. We always talk about the advances in medicine and what you guys are doing over at Midwest Orthopaedics at Rush. What about preventing the overuse of opioids following surgery?
Well, Steve, it's
right?
something. It's something you see. It's a political issue. It's an enormous public health issue. The opioid crisis has been one of our greatest challenges over the last 10 years, and specifically as it relates to orthopedic conditions, we have a primary responsibility when it relates to either managing patients who come in who are on opioids, or even more importantly, not creating a problem that didn't exist before, especially if they need surgery to manage some of the most difficult problems.
Let's bring in Dr. Kern Singh. He is an orthopedic, minimally invasive spine surgeon from Midwest Orthopaedics at Rush. Dr. Singh, thanks for joining us here on Sports Medicine Weekly. First question, what is the opioid crisis in America, and particularly spine surgery?
Well, thank you guys for having me on. It's a big topic. I mean, what people don't realize is that the new statistics say that 1 in 3 patients start with a narcotic medication afterwards, after surgery, after some pain that they may be experiencing, and then they can end up becoming either drug dependent or heroin dependent.
Wow.
What are some of the things that you're doing? I know you are clearly in our group at Midwest Orthopaedics a leader in minimally invasive spine surgery. It's still surgery. We've been paying a lot of attention to try to find alternatives to narcotics, because that can set the stage for future narcotic use. So how do you do it now? What's the best way to manage surgical pain to also lead to an uneventful recovery?
So I think that I think we've come a long way in understanding what exactly pain is or how it evolves. And I think that several years ago, and even up into the present, we treated pain with only one type of medication, which is a narcotic. And I think that the science has kind of evolved behind it, and we realize that pain is multifactorial. And the example I always give is, you may stub your toe against the wall and you feel that pain, and you can take a pain medication for it, or you could numb your toe up, you could take an anti-inflammatory medication, and you can reduce that amount of pain that your brain experiences. So we're learning that pain is more multifactorial than it is just one single tablet of narcotic to take care of it.
So give me the rundown. If I were to need cervical spine surgery, we were doing this in a surgical center because of, say, a disc in my neck. What would I go home with? So now you'd go home with
a pain medication that's not a narcotic. In general, we use something called tramadol. So it would stimulate those same receptors in your brain, so your brain would think you're getting that kind of narcotic medication, but you're really not. You'd go home with a muscle relaxant, because you'd typically have spasms in your neck, and that's best treated with the muscle relaxant versus a pain medication. And you'd go home with an anti-inflammatory medication to reduce the inflammation that may occur after surgery.
What are you using? What's your NSAID of choice now?
Well, typically we use meloxicam. It has probably a longer-acting, kind of a 12 to 24-hour profile. So I tell my patients who either have surgery or even have back or neck problems and have not had surgery, that medication is very safe to take. And if they're going to engage in something strenuous, to take the medication an hour or two beforehand, and then potentially they can take a tablet after 6 to 8 hours after that activity. And that helps them go through the activity, helps them get to sleep at night, and they wake up the next day not feeling sore.
Visiting with Dr. Kern Singh, orthopedic, minimally invasive spine surgeon, Midwest Orthopaedics at Rush. This is Sports Medicine Weekly. Steve Cashel, Dr. Brian Cole. I want to ask Dr. Singh this. What are pain expectations patients should have undergoing spine surgery using contemporary anesthesia techniques?
How much pain should they expect? Question. Yeah, how much pain should they expect?
Yeah, I mean, it's a great question, and actually, they should actually expect not much pain afterwards. As you guys mentioned, we're doing these spine cases. That means disc replacements, artificial discs in your neck. It means cervical fusions. It means lumbar fusions in the outpatient environment. So you have incisional pain, which is kind of things that feel sore in your back and your neck. But these patients, post-operatively, they're up after an hour or two after surgery, and they're walking out the door of the surgery center 4 to 6 hours after their surgery. So a lot of it's like preoperative education, But in general, people wake up comfortable, and they wake up comfortably enough that a couple hours later that they're walking out of the surgery center.
So Dr. Cole, Dr. Singh, the whole key is you're trying to avoid the narcotics, right?
Yeah, I mean, there's a definite association with, early narcotic use and future narcotic use. Kern, what are some of the statistics that you're aware of in that regard?
Yeah, almost all potential people who become addicted have started on something very light, so to speak. So Tylenol number 3, hydrocodone, it's 1 in 3, 1 in 4 patients use that medication. It's not because they're going out seeking this. They're genuinely trying to treat their pain. And unfortunately, we as physicians have used just kind of one type of medication as a catch-all for every type of pain ailment. And each thing requires, fine-tuning with whatever the condition may be, and hitting that pain with a specific medication that addresses that issue.
Great stuff, Dr. Singh. We appreciate you joining us here and for your expertise on Sports Medicine Weekly.
Thank you, guys.
All righty, it's Dr. Kern Singh from Midwest Orthopaedics at Rush. Time for a break here on Sports Medicine Weekly. When we return, it's our staple of the show, our Ask the Doctor segment. Got some great questions for Dr. Cole this week, so stay with us. SportsMedicineWeekly.com, only on
670 The Score.